Hi everyone, welcome to our Expert Insights podcast tonight. So we'll get started. Before we do get started formally on the podcast, I just wanted to give my acknowledgement of country. The Black Dog Institute would like to acknowledge the Aboriginal and Torres Strait Islander peoples as the first people and traditional custodians. We value their cultures, identities, and continuing connection to our country, waters, kin, and community. And we pay our respects to elders past, present, and are committed to making a positive contribution to the mental health and well-being of Aboriginal and Torres Strait Islander people across Australia. Just a few housekeeping. If you have any questions tonight, we'd love for you to use the Q&A box just at the bottom of your screen there. And our expert panel members will be monitoring it as well. We are hoping to answer all the questions live if possible, but sometimes we can't get to all the questions. So we'd love for you to pop those questions in. We have a couple of questions prepared for tonight's podcast, but of course we love audience participation and we can't see anyone. You know, this is a webinar, and so we'd love to hear from you somehow so it doesn't feel like we're presenting to a void. So do appear in our Q&A. I'd love to say hello as well, and put in the questions because we'd love to interact with you. So tonight's topic is online CBT programs, treatment options during COVID-19. Our podcast has changed quite a bit since we went into COVID-19 lockdowns to varying degrees across the country in terms of the restrictions that we're facing. And so when we began to pivot the series into an online event, we started to really focus in on the new tools that we may be needing in primary and allied health to survive these restrictions. So one of the big topics that came up was online CBT programs. We sort of covered it just as one of the topics of the digital tools, but we wanted to go more in depth today. As one of the major tools that practitioners could be using. We know, for example, our colleagues in Victoria are dealing with the real scenario of doing face-to-face sessions with face masks, right? Wow. And across the country, our immune-compromised clients, even without those restrictions, perhaps not being able to attend face-to-face, maybe they're struggling with telehealth and generally not being able to maintain that momentum in treatment despite the escalating stress like social isolation as a result of COVID-19. So online CBT, we thought, might offer an avenue to address some of these barriers. So tonight we're going to chat to our experts who have helped develop these programs, as well as experts who've promoted its use and have used it themselves in clinical practice. And we're going to discuss what their experiences may have been like and what they have found useful. So I'm going to do a little bit of a roundtable and get everyone to introduce themselves and, maybe in relation to what they know about this topic, what you do. So we might start with Sarah Barker. So Dr. Sarah Barker.
Okay, thank you so much, Carol. I have started using e-mental health, probably an online CBT programs. I've used them more during COVID, but I worked in a school for many years. I led a counselling team of psychologists in the school, so I used them a lot with young people, the online CBT programs. I'm now working in private practice and working with children, young people and adults, and I find the online CBT great. It's been a really great adjunct to consolidate the work I do with clients. So yeah, that's a little bit about me, and I also work at Black Dog Institute.
Kathleen, would you like to introduce yourself and tell us a little bit about what you do?
Yes, thanks, Carol, and hi, everyone. So I'm working at the Black Dog Institute at the moment as a senior clinical research manager, and I'm trained as a clinical psychologist. So my first exposure really to online mental health programs was in private practice as quite a newly registered psychologist. And then I was able to work at the clinical research unit for anxiety and depression at St Vincent's Hospital, and a lot of the online programs that they developed that end up as This Way Up programs. And now at the Black Dog Institute, we are looking at online mental health programs and how they can be integrated into routine care, routine practice of health professionals.
Thanks, Kathleen. And Dr. Jan Orman.
Hi. Thanks, Carol. I'm a GP. I've been a GP for a very long time, and for the last 25 years or so, I have worked in a university health service. I have to describe myself as a GP with a special interest in mental health. And of course, the university health service was a good place for me to be, given the demographic there. And it was also a good place for me to try some of the online treatment programs that are available. I also work as a professional education facilitator at Black Dog Institute. And in that role, I have another arm, and that is designing and developing and delivering all the education programs for the Black Dog Institute's arm of the E-Mental Health in Practice project, which is in fact a project, a federal government funded project designed to help people become familiar with and understand the online treatment programs and understand how to incorporate those into their day-to-day clinical work.
Thanks, Jan. So Jan, we might actually start with you while we're on to e-mental health prac and the fact that you've been trying to introduce some of those digital tools. You're particularly familiar with the different types of digital mental health support that's available for use by primary and allied health practitioners. Can you tell us a little bit about the different types of online CBT programs and what they offer? Do you have a favorite?
I think we have to define digital mental health before we get going. As it's used, e-mental health or digital mental health is a broad term that includes online treatment programs, but also includes websites for psychoeducation and apps that you might use for symptom control. I think today we're going to confine ourselves to talking about online treatment programs. Yeah. And there are a number of different online treatment programs. The first Australian evidence-based online treatment program was Mood Gym, which came out of ANU and was launched, believe it or not, in 2001 with a lot of evidence to support its use, particularly in young people for whom it was designed. But subsequently, there's been a lot of evidence from around the world in other age groups and in conditions other than just resilience building. The name, as it suggests, means that the program is a gymnasium for your mood. It helps with resilience building, but it's also good in the treatment for anxiety and depression, mild to moderate anxiety and depression. But since then, there have been a range of other programs developed for specific diagnoses and for transdiagnostic purposes, and most of them have no guidance, but there's a program called MindSpot that comes out of Macquarie University that actually offers clinician guidance to the users, and it's free of charge. So I mean, there's a lot out there that's worth looking into. And each of your patients may require something different, but the best way to start is to get to know something really well and advise people for whom it's appropriate to use it. Did you ask me what my favorite was?
Yeah. Are you allowed to declare a favorite, or do you love all your online CBT program equally?
I'm probably not allowed to declare a favorite, but it's worth mentioning that the This Way Up suite of programs from CRUFAD, that's St Vincent's Hospital and the University of New South Wales, probably has the biggest body of evidence to support its use, but it does cost $59 to the user for each of the diagnosis-specific programs. But the other one that's unique is Black Dog Institute's own My Compass program, which is unique in that it's not linear. In other words, you can go in and do whatever module you want to do in whatever order you like, whereas all the other programs are linear and you have to go through a bit of CBT training before you get onto the things that are relevant to your symptoms. So for a lot of practitioners and a lot of users, that ability to go in and look immediately at sleep or stress or whatever problem is most pressing at the moment is a good thing about My Compass. So there you are. I have showed my colours.
So we might turn to Kath now, because Kath, you are our researcher on the panel, and I'd love for you to tell us a little bit about your journey, because you're a clinical psychologist and you've journeyed into researching online CBT programs. When we first spoke, you talked about being a little bit dubious, about online programs when you first started. What have been some of your most surprising discoveries?
Yes, Carol, I think when I was a newly registered psychologist working in private practice, I didn't really know a lot about online therapy and internet cognitive behaviour therapy programs. So really, I was unsure because I didn't really know how they were developed. I didn't know the content of them. I didn't know how they were evaluated at the time. But I was seeing a lot of clients that were bulk billing, and I found them really useful for those clients who could continue to learn skills when they could no longer afford to pay for sessions outside of what was provided through Medicare. So that was my kind of initial exposure to internet CBT or iCBT. And then during my doctorate, I was fortunate to complete a placement at CRUFAT, as Jan said, and then work there later. And that was when I first really was had exposure to the scientific literature, the large evidence base that now exists on the efficacy and the effectiveness of online programs. And I was really lucky to be involved in a lot of that research. So I got to see how the programs were developed and how they were evaluated over time. And by guiding through a lot of the people through the programs, I kind of had that one-on-one connection where I saw how the programs benefited different types of people. So whether that was someone that was older with kind of chronic conditions, people that were living in rural or remote areas, even with mining jobs, people that couldn't see a face-to-face clinician during the day because of their long work hours or looking after children, or maybe they didn't want to see someone face-to-face or couldn't afford it. So that was really great experience for me, kind of getting to understand iCBT programs. And I really brought a lot of that experience with me to kind of Black Dog Institute and a lot of the work we're doing here on digital mental health programs and integrating them into routine care.
It sounds like you were seeing research participants that we sometimes rarely see in traditional RCTs, right? They're the ones who can show up, the really high functioning ones, and can afford to come in face to face. You were actually accessing the individuals who may never turn up at a university. They're out in a rural, remote region, and they're actually checking in and being able to connect with those individuals and seeing how CBT is actually working. Sarah,
yeah, and I was really surprised. One of the I was really surprised that one of the studies we were looking at was, looking at iCBT for depression in people with osteoarthritis, and really, people that have chronic issues where they couldn't even really move around to get to maybe a face-to-face therapist. So it really highlighted how that mode of delivery can overcome a lot of barriers.
Yeah. So Sarah, you use CBT programs in your private practice. Can you tell us a little bit about how online CBT programs have complemented your practice as a clinical psychologist, and which online CBT programs have you used with clients and found useful?
Yeah, okay. So I might start, probably I first started using them in schools with young people, and I found them particularly useful there. So this was secondary school students, because often a student might just come in for one session. So if I had a program, if I knew that anxiety and depression were the symptoms that they were experiencing, and I knew there was a program like Brave, which I knew well and felt comfortable and confident to recommend, I could set them up with that. I might never see them again, but they had something in their hand that they could continue with. And if I got to meet the parents too, I could recommend the parent modules to the parents. In private practice, which I'm working in now, I actually find, a lot of the programs excellent. The This Way Up programs I'm probably particularly familiar with, and I have a penchant for them. So I find particularly with clients with OCD, as Kath was saying, often people will have 10 sessions that they're able to access per year, whether that's bulk billing or through Medicare. And they might not have the funds to access further sessions. So if I have an adolescent or an adult with OCD, that's not going to be enough sessions for me to do all that I want to do with them, particularly if a person perhaps has insomnia and OCD. So what I might do is do some pre-work with them, explain the CBT online program to them and link them in the initial sessions to those as well. So we might do some initial work together on insomnia very briefly. I might introduce them to the This Way Up for Insomnia course, for example. So that's kind of, I'll check in about that. I'll always follow up and check in on how they're going with it. And then I'll start doing some of the exposure response prevention with them for the OCD. But what I find is if I link them in early and can consolidate the work we're doing with the This Way Up, it really reaps better clinical results. They get better outcomes more quickly. And then because they're already familiar with it, because we've had 10 sessions using it, when they do finish up the sessions with me, they're able to continue with that and be comfortable with that and continue to work on that. And I think the ability to revise the sessions too is very good, so that they can consolidate those concepts, particularly for anxious clients too.
Sounds like you're almost like using it as an adjunct tool, right?
Totally.
That it doesn't feel overwhelming. You've got a client that's coming in presenting with a lot of difficulties, and sometimes you're thinking, where do I start? And then you've got, maybe we'll put sleep onto this online program, and then we can work on the OCD, which requires more of that face-to-face.
Yes, go on, Jan. Sorry, yeah, that's exactly right.
It's probably worth mentioning that the This Way Up sleep module is actually free of charge. It's not one of the ones that you have to pay for. And I wanted to ask actually what you thought of what I do, which is if somebody's going to a psychologist but can't get an appointment for a little while, I'll get them to go online and get some basic CBT training so that by the time they get to the psychologist, they know what they're getting themselves in for, and they know, so they've done a little bit of work, which will save some of the session time for the psychologist, that then the psychologist's work will just be revision. And I just wondered whether you three psychologists thought that was a good idea.
I love it when clients come with some pre-preparation, Jan. So for me, that's because I really see those 10 sessions as really precious. Sometimes people have more, but if they've got 10, they're really precious. So any pre-work they can do and background familiarity they can have, that's just gold, I find, because then we're speaking the same language when we come in. So it's great. Yeah.
You're making your... Sorry, Jan. It sounds like you're making this really important point as well, which is a lot of clients complain, I've got to wait a really long time to get in and see a psych. And sometimes I have clients coming in, I'm like, I'm not open for another 2 months. Please go see somebody else. And they're like, no, we want to just see you. And it's such a great idea to be able to go, look, the online program, let's get you started if you're going to wait, rather than just have this blank space for 2 months, not doing anything and just potentially getting worse, just waiting for your preferred psychologist.
Can I just say the other place it works too is the people who really don't want to go and see somebody face to face because they're scared of what it means. Will this person be able to read my mind, or will they diss my mother, or, the kinds of things that people are afraid that psychologists can do. So if they get exposed to some online CBT up front, they'll understand that the sorts of things they're afraid of aren't really what psychologists do. So that's been effective for me in the past as well.
Sounds like there's a bit of a taster of what therapy actually looks like, and giving them a sense that sometimes it's really about very much learning skills, rather than this really, scary depiction that we see in the media and in movies as well. I've got somebody saying, look, I think until the end of September, the fee is waived if clinicians recommend This Way Up program for the clients. I believe that is correct, Jan. I don't know, Kathleen, if we want to say something about the fees at the moment for This Way Up.
Yeah. As far as I was aware, that the fees were being waived as part of during COVID.
I think that finished at the end of last month.
It may have finished.
It was 30th of June.
Finished.
Yeah, and now it requires a special request from the clinician for the fees to be waived. So that happened automatically for 3 months. It was very generous of This Way Up to do that. And they actually found themselves flooded with users during the time that it was free, which there's a message in that.
Absolutely, absolutely. And look, there is a fee, but I will, for the full suite of CBT for $60, I think it's pretty a lovely, it's not not as high
It's
as what
very
we were
cost
paying for that
effective.
face-to-face. Yeah, absolutely. Now,
Don't be misled though. Every program costs $60. It's not $60 for every
all the
program.
program, correct.
Yeah, there are 11 different programs and each one of those costs $60, which is why it's a good idea to choose wisely at the outset.
That's a really good point.
I think too, for people to be aware that 3 or 4 of those are free: the student wellbeing one, the insomnia one, the introduction to mindfulness, and there's one more, Jan, which is
stress management.
That's right, yeah. So I'll often start people off with them so that they can get familiar with the style of the program, and then if they are comfortable with that, they can move to one of the paid options if one of them is perhaps more appropriate.
And if they decide they don't like it, they can either ask you for another recommendation or go to the Head to Health website and see what else Head to Health recommends for their particular condition.
Absolutely. Head to Health is such a great resource as well, because it just covers all the, and correct me if I'm wrong, Jan, it's sort of like the government recommended kind of tools that are available. Is that correct?
Well, it's a portal that is a repository of all the online tools that are available. So if you go to Head to Health and click on Sam the chat bot and tell Sam what ails you, Sam will lead you to the appropriate resources for someone that's in a situation like yours.
Okay. So it's clear we all love the online programs, the CBT programs. Sarah's used them in private practice. But one of the things I often hear in terms of clinicians being a bit dubious about recommending them, or even just from the general population as well, is this idea that, look, online programs don't work as well as face-to-face programs. So I'm going to turn now to our resident researcher. What is the evidence on efficacy for online CBT programs? Do they only work for your really mild cases for anxiety, depression, or is the evidence starting to emerge that their efficacy is up there with face-to-face?
Yes, Carol, I think I would definitely say that the evidence base is not only has emerged now in terms of there being a very strong evidence base for the effectiveness of iCBT. There's been, over the last decade, a number of meta-analyses that have actually looked at iCBT compared to face-to-face therapy and medication as well. So that we do know now that it is highly effective. And one of the kind of misconceptions, I think, has in the research world has been that, well, perhaps, maybe they've been shown to be comparable because the sample in the iCBT group have more mild or moderate symptoms. But research has actually shown that's not the case. When we look at the research studies of the participants that are in those iCBT studies, they are actually, just as complex as the participants that are in the face-to-face studies. So we know that, people with mild, moderate and severe symptoms are accessing online therapy programs, and that they can actually benefit from them, because if we think about it, if we have more severe symptoms, we have more to gain in a lot of ways. We have a further way to go, if you could say it like that, in terms of our kind of symptom improvement. So we do know that people with more of those severe symptoms are accessing iCBT programs and that they can benefit from them. I think it's always important to mention that the research has shown, and we do know, that guided iCBT is more effective, especially when we're considering people that may have more complex symptoms or severe symptoms. We need to kind of be looking at each client in an individual way and considering what would be most beneficial for them. So we might be looking at blended approaches of guiding someone through ICBT.
The definition of guided is interesting, isn't it? It doesn't necessarily mean the kind of guidance that you get from MindSpot, from someone at the end of the phone at the clinic. It may be the guidance that you get from your GP or your psychologist or your psychiatrist. So guidance, wherever you get it from and whatever form it comes in, will make that ICBT work better. And the other thing that I want to pick up that Kathleen said was that you can benefit from using ICBT. You don't necessarily get cured of what ails you, but everybody, no matter what their level of severity, can get some benefit from it. I think that's worth keeping in mind.
Absolutely. So, there is a real fear though. We know that they work now. And so the other argument comes into play, right? So the first argument I hear from clinicians is, oh, well, they don't work as well. And we're starting to find out that they do work and people do glean that benefit from using ICBT. And the flip side now is people saying, look, I have this real fear of promoting online programs because they'll take over that face-to-face. And then we will just, have these big centers where it's just running these automated programs and it's going to take over face-to-face sessions for psychologists and psychiatrists. And what will we say to that, Jan? What do you think? Because this is a fear I hear a lot from different clinicians in having this real reluctance to incorporate ICBT or even recommend them as they see them as a competitor.
Look, I understand the logic behind that fear, but really in the end it's an irrational fear because the need for psychological support is greater than any psychological workforce is ever going to reach. And if we can fix the people who are fixable by just simple CBT with an online program, that leaves psychologists available for people with more severe or more complex problems that definitely need the face-to-face instead of, or ideally as well as, the ICBT programs. So I don't think anybody's going to run out of people to see anytime soon.
Absolutely. Is that your take on it too, Sarah? Because you've always had this really open approach towards, incorporating ICBT and online programs.
Yeah, I would very much agree with Jan. I think, it's not a competitor at all. For some people, I really think it actually even suits them better as well. Some people might never come to face-to-face, but it's a really comfortable option for people who, might have some fears or, a discomfort about coming to us. But no, not a competitor. I think at the moment during COVID, I'm not sure about in other states, but I know in Melbourne, most APS psychologists on the website listing are booked out at the moment, and I've had people trying to get in to someone and really pleading and saying, everyone I've called hasn't. So I think, particularly during periods of high stress like the pandemic, they're just such a necessary option. But always I think they're and I really think they add to our work that we can do and add to the effectiveness of our work. And really our goal as clinicians is to get the best outcomes for the people that we work with. And if that means, and they're open to ICBT, then that is the best way forward. Now,
do you think there are... Go for it, Jan.
I was just going to say what may happen, and this might not make everybody happy, is that psychologists might lose their easy patients. That was what happened to GPs when bulk billing clinics opened. The GPs that weren't doing quick bulk billing sessions were left with just the more difficult consultations. So that might be the downside.
If that is a downside, I quite like the more challenging cases as well. So, there's like a kind of the glass half empty and half full, isn't it?
Yep.
Are there specific presentations or client types that fit online CBT a lot better? So, in terms of our colleagues listening in, they might not want to recommend everyone to ICBT, but are there some, beyond just the fact that, they might be living quite far away or they're on a waiting list, what are specific presentations that you think might be particularly suited to online CBT programs? I might do a little bit of a roundtable here, because I think, you know, you're probably already thinking about some clients that might really suit. We might start with Sarah. What do you think?
Yeah, okay. So I suppose a few things come to mind for me. So I think mild to moderate symptoms is really ideal, but also severe, but mild to moderate is probably a really great fit. I think people who are tech savvy, I find a lot of young people are really keen to try that, and they like it, especially if the graphics are good. The graphics matter.
Go this way up.
yeah. Well, the graphics actually matter a lot, because some people will be turned off by the graphics, and I have to then find another program for them. But yeah, people who are tech savvy and comfortable using that. I also find a lot of more introverted patients I find can prefer online, because even therapy can be a bit draining, maybe sometimes to have to leave your home, go outside, sit with someone to face-to-face. And sometimes too, I find clients on the spectrum with ASD will be quite comfortable working with an online program at their own pace and doing it in their own time. There's no eye contact, so that can be a really good fit, I found too. In fact, I remember one young man that came in to me, and he said to me, he said, I don't really like meeting with you face to face. He said, can you give me any books or any online programs? I said, well, actually, I can. And then he would just have very short sessions with me. We'd have about a 7-minute catch up. He would let me know what he's doing. And he actually made great inroads on what he was doing, because it was such a better fit for him than face to face. Yeah.
I find it very hard that anybody would not want to see you face to face.
Oh, no. He was very frank right from the start.
There we go. That rare person.
No.
0.01%. What about you, Jan? Have you found like a specific patient that you've seen that might be particularly suited to online program and not suited?
Well, it's really hard to tell, from superficial appearances. Whatever you do, I'd like to make a plea on behalf of older people. Don't assume that someone older is not going to take to it, because a lot of people in their retirement have taken up technology in a big way. So you really need to check it out. And there are actually, believe it or not, a few young people who are not interested in doing anything online. I'm not sure that I've met any of them, but no, that's not true. I have met some. So age is not something to make assumptions about. And the other place that I've found it most useful is one step before the people with mild to moderate disorders, the people who have subsyndromal levels of disorder, who are in vulnerable groups. So someone with a strong family history of anxiety or depression, someone who's got past experience of trauma or bullying, who hasn't got anxiety, depression, PTSD, whatever themselves, but because of their experience or their family history, got risk factors for developing it. Those people could really, really benefit from learning some CBT skills and strategies to help prevent the development of mental health problems. And so I'm quite keen on prevention, and I think that's a really good place for online programs.
That is such a good point, Jan, because we can't, like, Medicare doesn't cover prevention. There's just not a lot of options, and ICBT is such a great option, isn't it, for that prevention? We're seeing that mild stress, and we've got these risk factors. Let's get you online, just trying out some of these strategies. Kath, what about you? I'd love to hear from you actually about clients that might be suitable, but maybe you have some insight of clients that aren't suitable, because in your research trials you would have had to make sure that some clients don't enter that ICBT program, right?
Yeah, that's right, Carol. So I would completely agree with both Sarah and Jan. So in terms of the research side of things, we know that there's the strongest evidence base for people with anxiety and depression, and for people that the programs are often designed for people with more mild to moderate symptoms and tested in that environment. And I do want to agree with Jan that even even in my experience of working on studies with older adults with kind of chronic health issues, that was something that really surprised me, how much they really took to online programs and really loved it. And it was something that they could do with their day, you know, and especially when they had chronic health issues that made kind of getting around more difficult, it was something that was really exciting for them, and they were really engaged. So in terms of, you know, the research kind of evaluation of online programs, we do often sometimes have eligibility criteria for, and we might not include people that have high levels of suicidality or psychosis or substance abuse or dependence, just because of the complexity of those presentations and the benefit that they would gain from seeing someone face to face. So they are always considerations, and I know that health professionals would always take it, you know, on a case-by-case basis of what would really benefit that client. But online programs kind of really, for a lot of clients, I think it's good to not assume that they might not be interested, and ask them if it's something that they would like to have a look at, you know, because we might even be surprised ourselves of the people that would be interested in it and may benefit from it.
I think the important message you've got to give them when you recommend an online program is that you're not recommending it in preparation for abandoning them. You're actually going to continue to see them while they're using the online program.
Yes.
Absolutely. Kath, so a big question I have in terms of the online program is, you know, with face-to-face, we sometimes already struggle with clients being able to stick to the program. And what are the attrition rates for online CBT? Because that's another argument. It's like, oh yeah, people log in and then they kind of quit halfway, or they just kind of check in and then they leave. What's the attrition rates? Do we see, you know, people sticking to online programs?
Yeah, I think that would probably surprise a lot of people in terms of, it is a major concern, obviously, for us when we're seeing people face to face. And it is a concern with ICBT, especially programs that are not guided, because that does really require a lot of motivation for the person doing it in their own time. So really, when we look at attrition or dropout, it's every single study often defines it in a different way. But what we do know overall is that in the real world, actually the attrition rates are quite similar for face-to-face therapy and guided CBT programs. So obviously in the research world, the dropout rates are less because it's a much more controlled environment, and we're kind of doing it in a more intense way. But in the real world, there's a lot of similarity there. And again, I'll always keep coming back to, we do know that a program that has some type of guidance, like Jan said, the research is actually showing this may only be a very small, you know, 10 to 15 minute kind of check-in, may not even be a therapeutic guidance. We do know that would help with attrition.
Yeah, I think, correct me if I'm wrong, Kath, I believe that This Way Up did some research too that showed that the people who paid were stuck to the program better than the people who didn't pay but were using the same program. Is that correct?
Yes, my memory when I was working there is that was actually one of the arguments for having a fee for the courses, that it really, what would you say, kind of engaged the client and motivated the client in their own recovery, and engaged them from the start with the program. Similar to when you see a face-to-face therapist, you pay for a service, and yeah, that was some research that I think was part of the rationale for having a very small cost for their online programs.
Absolutely. Now we have a question in the Q&A box, which is actually your next question on my piece of paper here, Sarah.
Perfect. Yeah.
Which is, how do you go about encouraging clients to use an online CBT program? So anonymous attendee here has asked, any tips for engaging someone who doesn't look at any online course suggestions you've made? Would you bring it into the course? Would you bring the course into session somehow? What have been what are some of your strategies to get somebody to even log on online?
Sure. So a few things. So first of all, I get really familiar. Anything I'm going to recommend, I get really, really familiar with myself, and I kind of know as back to front as I can, so that I feel comfortable with any questions they've got. So often I'll recommend it first. I'll introduce it, I'll provide the rationale for it, and I'll explain what I can see the benefits could be and how it can work as an adjunct, and the results I've got with people who do both, who do the face-to-face and that as an adjunct. So I think kind of get some buy-in and engage them in that idea of this could be really good for you. You want to get stronger well-being, and this is a really great path to doing so. I will often, perhaps a first session, particularly with the free courses, go through perhaps part of a session to show them what it looks like, to show them the graphics, to let them ask any questions about how to engage with it or what they do or the different parts of it. And I find spending a little bit of time doing that often does help with the take up. And I will always revisit it in the session as part of my homework check, so that it doesn't fall off and not get used, or that there's not any follow-up. I think that follow-up and that interest in how they're going with it is really important. And any questions, any struggles they're having too, or ways to overcome them too. So yeah, that's really important. And I find take-up is then better.
Absolutely.
No one's going to do it if you hand them a post-it note with the URL written.
No, not at all.
In fact, I find that I need to show them what it looks like on my desktop, and actually, if I've got time, go through the process of registering them on my desktop, or better still on their phone. If they can open it on their phone, then they've got a record of the URL in their website's opened record on their phone, and that there's no excuse that they lost the piece of paper or whatever. But it's that familiarizing process in the room with you to guide them about where to go next. That's important. Now, for busy GPs, it's actually quite useful to have your nurse guide them through the registration process. And there's always a questionnaire at the beginning of all these programs. Kath, I think that questionnaire is in order to sort them. It uses an algorithm to sort them into which program to use and to make sure they're safe to use the programs. Is that right? Yeah, so they'll always have a registration process and a questionnaire to answer. And if you practice nurse, if you haven't got time, if your practice nurse can guide them through that process, then they're already registered before they leave the building. And that's a key to engagement as well.
Absolutely. And it sounds like, look, we're talking a lot about this way up, but what I love about it is that you can prescribe it. So as a clinician, you can hop in there and you've prescribed this treatment, right? And hopefully you can sit down and walk them through it, but you can actually figure out which module they're up to. Like you can actually track whether they've done it, because you get this little email that says, look, your client's completed session 2, which is fantastic. And if not, you can kind of track whether they've been doing some of that work in between the face-to-face sessions.
It's important to remember that in order to track the patients that you refer to This Way Up, you've actually got to register as a referring clinician. So you go to the clinicians part of the This Way Up website and register, and then you can type in the details of the people that you refer and easily go back, and with a single click you can find out whether they've done anything or not and what their scores are after each lesson or before each lesson, so you can track them nicely. And
so go on.
No, I was just going to make some remark about the other programs being good too.
Yes, they are. They are.
But it's just that This Way Up's got this clinician tracking facility.
Absolutely.
Which is worth... sorry, go on.
it's not to neglect somewhere like MindSpot, for example. I've heard some remarkable feedback from individuals who were so ambivalent about seeing a psychologist, and they worked through the MindSpot program and just found it so useful that they then followed up to make sure they checked in on their mental health, even though they were doing so much better. It really reduced that stigma around just checking in with the psychologist, having had that insight, that preview into what it looks like. So, you know, it's really helped there as well.
And
so
Carol, if I can just tell a story about MindSpot, I don't know if you're aware, but MindSpot has got a PTSD program. Now, before you all recoil and say, how can you possibly treat PTSD online? I tell you that I have sent a very, very disturbed patient to the PTSD program from MindSpot with a little bit of prefacing that, hey, this is not going to cure you, but it is going to help you manage your symptoms. That's what the aim of such a program is. And my patient, who was very disturbed, as all of you clinicians can imagine someone with PTSD can get, really benefited enormously from it, more than any book she'd ever read about managing her flashbacks and her other symptoms. That somehow or other the program from MindSpot just crossed her threshold. So it's worth thinking about these things with complex patients, because just using them to manage specific aspects of their difficulties is a worthwhile consideration.
Absolutely. Now, just to correct me if I'm wrong, Jan, but I believe that MindSpot is a little bit more linear and it's cyclical, right? You kind of have to wait for the program to start.
You sometimes have to wait 2 weeks for the lessons to start, and it's 5 lessons over 8 weeks for all of the different programs in MindSpot.
Yeah, so it's a little bit more linear, a little bit more structured, and there is also that guidance as well. Is that correct?
Yep. Can we just reassure David that This Way Up does recognise allied mental health professionals as referring clinicians? So yes, mental health social workers can become referrers to This Way Up.
We do have this other question, and I'm not sure if any of us want to try and answer in the chat box. Is there any concern that Medicare bulk billing programs will be reduced in favour of online programs? It'd be a shame for low-income patients who would benefit from in-person sessions to lose access to them.
I've got an answer to that. It's no. There's no concern whatsoever. The APS is an incredibly powerful organisation, and they are not going to let that happen.
Yeah, I would agree.
It's a common concern.
It is a common concern, but I think it's very, very unlikely that anything like that is going to happen.
Absolutely. Okay, so we have answered that.
Two things I just want to pop in, Carol. I wasn't registered as a clinician for This Way Up for some time. I used to just refer. I've reaped enormous benefits by registering. I didn't realise, I thought that might be a bit more involved or I might have to do a whole lot more. Instead, it's actually been fabulous to get access to those results. So I do encourage people recommending it to register as a clinician. It's easy, it's free, and it's, you know, gives you great access to familiarity. And the other thing, talking about the linear programs, the non-linear program I love is My Compass.
Yes.
And the ability for people to dip in and out to different sections and not have to follow a structure. I think that is really great for anxiety and depression too. And I've had lots of people give really good feedback about My Compass as well. So that's, you're just mentioning the linear programs, the non-linear one, that's beautiful, I think, and lovely and flexible too, depending on people's needs.
Fantastic. Now, Kath, you know, what's the future in terms of the research horizon for you? We've talked about some of these great programs, and you're right in the thick of you're at the vanguard of the innovations in online CBT. So can you tell us a little bit about what your research plans are with Professor Jill Newby at the Black Dog Institute and how we can help?
Yes, definitely, Carol. So I guess, Sarah, I'm glad you brought up My Compass. You know, within the Black Dog Institute, that is, you know, really our kind of flagship digital mental health program. And it has a really great modular approach. Like Jan has said previously, she'll often kind of select modules that she's using with clients to support what she's doing with them. So I'm working with Jill Newby here within the Institute, and we're looking at an online therapy program, My Compass, and ways in which we can integrate it into routine care. So we are looking at how could we find out from health professionals how they use online programs currently, and also how would they like to use them? You know, what would be the ideal? Because as we've talked about, there's MindSpot and there's This Way Up programs, and My Compass at the moment is self-guided in a sense, but a lot of people can use it with their patients as well. So we would love to hear from any health professionals about their experiences with online programs, including My Compass, how they use it with their patients or their clients day to day. And we'd also love to hear ideally how they would like to use it, because you know, we know that clinicians are using online programs in a variety of different ways, and we're quite keen to find out if we can support health professionals more in the way that they use online programs like My Compass. So we're conducting that research at the moment, Jill Newby and I, and we are really hoping to hear from any listeners here or any health professionals, and the way that they can get connected is through our Black Dog Institute community of practice. So I know Jan has a lot more experience in this area, but if they go on to the blackdoginstitute.org.au/COP for community of practice, they can find out more information about that community that can support them in a number of ways, but we will be posting information about this research that we'll be doing within that community.
And when you go to the community of practice, you may just recognize a few of the names of the people that are talking incessantly on the community.
And we've also got a few slides here. I don't know if any of these apply to what Kath was talking about, but we've got, you know, visit our website. We've got a few resources to support you. You can also follow us as well. I'm just trying to find the next slide. We've got the 10 The Essential Network, as well as My Compass, and also the Black Dog Institute online clinic. And you were talking about the COP as well. That's how we get COP community of practice. That's how we get in contact with Kath in terms of giving you some feedback as to how we use these online tools. Is that correct?
Yes, we'll be promoting it via Black Dog Institute social media channels as well. So on Facebook and through other, you know, social media, Twitter accounts that we have, and on the website. So really, there'll be a variety of ways that we'll be letting health professionals know when we are starting to kind of seek that information through online surveys and interviews and workshops, creating solutions that might help them with using online programs in their day-to-day practice. So they can connect with us via the Black Dog Media social media channels, and they can sign up to the community of practice as well. So we'll be sharing lots of information about the research on both of those channels.
Fantastic. Now, to end with, I'd like to turn back to Jan now, because I've got our GPs listening in, our allied health practitioners, and maybe, and I can think back to a time when I was like this as well, a little bit ambivalent. I'm like, I've heard about This Way Up, I've heard about MindSpot. Where do I start? Do you have any tips about where to get started first? Which tool, what do I land on? It's feeling a bit overwhelming. There's a lot out there. Jan, what are your tips for the GP or the psychologist looking to get started here?
Well, I just put some URLs in the chat box that might be helpful. The URL of the MPRAC page of the Black Dog Institute website. I've been beavering away there since 2013, producing all sorts of resources to help people get involved in using online resources. So you'll find not only a bunch of videos and webinars to watch. We're coming up to our 42nd webinar from the MPRAC team, and each of those webinars addresses a particular topic and looks at what online resources might be useful for those. Have a look at the hoarding webinar if you're interested, or even the chronic pain webinar that we did not so long ago, which talks at length about the This Way Up chronic pain program, which is something worth knowing about. So what I would recommend, that if you've not been doing any of this before, is that you get to know one program. Now, find a program that looks appealing to you, either by looking at the literature on the Black Dog website, or by doing the 6 module, what do you call it? ALM, which is accredited by all the GP colleges, and which non-GPs can get accreditation for as well. That's a 6-hour modular learning program that will acquaint you with all the basic online programs that are around. That's a great place to go as well. But from a practical point of view, get to know one thing. Get to know one thing really well, be it the This Way Up suite, or what MindSpot has to offer, or what Mental Health Online, which comes from Swinburne University of Technology, has to offer, or even, dare I say, get to know My Compass really well.
And it's right on the screen, guys.
And start by recommending that to people, and just seeing what kind of a response that you get. Use the tricks that we've been talking about to introduce it to them, to encourage their engagement, and as best you can, integrate it into the therapy that you're providing with them face to face. The other 2 URLs on the screen might be interesting to you too. Somebody in the chat box just mentioned the online clinic. Now, the online clinic is totally free and anonymous. It's a service provided by Black Dog Institute. It consists of a number of different questionnaires which provide diagnostic information. Now, your patient can access the online clinic easily for themselves. This is something worth doing when they ring up for an appointment, but you want them to get some diagnostic information before they come. They get the results in a easily digestible format of all the questionnaires that they've done, and they can print it out and bring it with them when they come to see you. So you've got the results of the PHQ9, stop me if I get these letters wrong, I'm not very good at it. The audit C, the bipolar screening test, the whole range of tests that they can do and get the results from, and bring you those results before, at their first consultation, if that's appropriate. And the other thing that I want to mention is the Essential Network, or otherwise known as 10. What's the L doing there, Carol? I don't think that belongs.
No, 10, it doesn't.
10 is a part of the Black Dog Institute website. So it's a page on the website, but it's also an app that's been developed with money from the federal government as part of the COVID effort. And it's specifically designed to help health practitioners of all kinds support their own mental health during COVID. So it's got everything from resources that you can use for yourself that are around telehealth, or working from home, or managing the kids while you're working from home. Everything from that to where to get peer support. So it's linked in with the hand-in-hand peer support network, on to where to get professional help from mental health skilled GPs or psychiatrists. So it's got a whole range of things. It's free to download from wherever you get your apps, and you'll find that it's increasingly, as we add more and more resources to it, it's going to be a very useful thing to have at your fingertips. So that's just to explain those 3 URLs that are there on the screen.
Absolutely. And, just to end on this note, we are in this restrictive period with COVID-19, but what a great time potentially to encourage you and motivate you to now search out these online resources and tools to really facilitate, some of the things we're missing out on in terms of being able to maintain that face-to-face contact with clients, or maybe the workload at the moment. There is help available online to hopefully be able to help you in your practice and your delivery of treatment programs. So this is just a gentle reminder that we've got podcasts that are recorded, so it ends up being a sound on SoundCloud, a recording, but also we are on YouTube as well now that we've gone on to webinars. So do check us out if you enjoyed this podcast, to look at the previous podcast as well, where we've covered a variety of topics. And thank you for joining us tonight. If you've got any questions, please do feel free to contact us on education@blackdog.org.au. I want to thank our amazing panel members tonight for a really interesting chat and some fantastic tips that hopefully our listeners can use to facilitate their practice, and also maybe try out some tools that they haven't, thought about trying before, and just experimenting a little, and maybe potentially finding out that it does complement and help more people get access to mental health support in the general population. So good night, everyone. Thank you very much for joining us. We'll see you later.
Thank you, Carol. Thank you, everyone. Good night.
Bye.
Good night, everyone.
Bye.